Welcome to today's Explainer. I am absolutely thrilled to guide you through this one because we're taking a topic that gets whispered about but is so widely misunderstood, and we're just completely flipping the script. Today, we're not looking at EG as just a performance issue, no way. Instead, we're exploring it as this fascinating, highly sensitive window into our body's entire cardiovascular engine. As you'll see, the health of our local vascular systems tells us an incredible story about our overall systemic human longevity. Let's get into it. Here's our roadmap for today. 1. An early warning sign. 2. The mechanics of erections. 3. The clinical evaluation blueprint. 4. Supplements and lifestyle tweaks. And finally, 5. Medical treatments and future tech. Okay, let's dive right into this with part 1, an early warning sign, why ED is a symptom, not the disease. So, we need to completely reframe how we view this common condition. Seriously, what does erectile dysfunction actually have to do with a heart attack? I know, it sounds like crazy high stakes, right? But to understand the true nature of ED, we have to immediately connect localized erectile function to our systemic heart health. They are intimately, biologically linked. It's like a giant puzzle, and these two pieces are right in the middle. But before we get to the why, let's destigmatize the who. 50%, roughly half of all men aged 40 to 70 experience some form of erectile dysfunction. If you take away anything today, let it be this. ED is a widespread biological reality. It's literally just a natural reflection of how our bodies age, not some rare, isolated failure. And here is exactly why it happens. It's called the artery size hypothesis. Think of the penis as the absolute canary in the coal mine for your cardiovascular system. Penile arteries are tiny. We're talking just 1 to 2 millimeters wide. Meanwhile, your coronary arteries, the ones feeding your heart, are larger, around 3 to 4 millimeters wide. So when atherosclerosis, or plaque buildup, starts to happen as we age, those tiny 1 to 2 millimeter arteries are going to get clogged and show symptoms way earlier than the larger ones. In other words, ED is often signaling hidden vascular aging long before a major cardiac event ever has a chance to happen.
Which brings us to section 2, the mechanics of erections, understanding the plumbing and the electrical.
To understand the dysfunction, we really have to understand the function. Clinicians generally divide ED into two main camps. Over on one side, we have psychogenic ED. This is driven by stress, performance anxiety, or depression. You can think of this as the electrical interference. But on the other side is what we're really zooming in on today, organic ED, or physical defects. Now, while stress absolutely plays a role, the hard data actually shows that roughly 40% of ED in men over 50 is purely vascular, driven primarily by that atherosclerosis we just talked about. So the absolutely crucial point here is understanding this precise, perfectly choreographed biological sequence. It all starts with brain signals. These trigger the endothelium, which is that super thin inner lining of your blood vessels, to release a molecule called nitric oxide. This nitric oxide is the magic key. It tells the smooth muscle in the arteries to relax and dilate, allowing blood to just rush right in. And finally, that blood gets trapped to maintain the erection. But as we age, things like oxidative stress and arterial stiffness physically break this delicate chain reaction, specifically by reducing that vital nitric oxide. Moving right along to section 3, the clinical evaluation blueprint, navigating the AUA guidelines. Now that we've got the biology down, let's shift to actionable medical steps. Let me share a really specific anecdote from the source material that perfectly highlights why looking at your entire metabolic picture matters so much. So there's this 47-year-old patient who decided to skip his doctor's visit and just ordered online pills instead. Well, he ended up suffering from headaches for weeks, and the results were super inconsistent. Eventually, he went to an actual clinic and discovered his fasting glucose was elevated and his blood pressure was borderline high. He wasn't just experiencing ED, he was experiencing the early stages of metabolic syndrome. Those online pills were literally just a temporary bandage over a much, much bigger issue. And that right there is exactly why the American Urological Association recommends this very specific, stepwise pathway. A thorough patient history and physical exam have to come first, followed by selective labs. Checking things like blood pressure, lipids, fasting glucose, and testosterone must always precede just prescribing a pill. You really have to fix the underlying engine, not just put tape over the check engine light, you know? All right, section 4, supplements and lifestyle tweaks, cutting through the marketing noise. Let's talk solutions, starting with the over-the-counter world. A massive trend right now is nitric oxide precursors, stuff like L-citrulline or beetroot extract. But format really matters here. In a 14-day adherence test that tracked real-world usage, gummies were super popular at first, but actually caused gastrointestinal pushback. specifically mild bloating by about day 10. It turns out the sugar alcohols used to sweeten them aren't always your friend, and those little gummy bears will absolutely betray your stomach. Capsules, on the other hand, aligned much better with daily morning routines and caused zero digestive mutinies. So, be an empowered buyer. If you're out there exploring supplements to support vascular health, you've got to watch out for these red flags. First off, avoid vague proprietary blends where they hide the actual dosages. Run far away from exaggerated results in 7 days guarantees. Vascular remodeling takes real time. Always look for third-party testing so you know for sure you aren't consuming heavy metals. Watch out for hidden subscription traps. And, like we just said, keep an eye on those high sugar alcohol contents if you value your gut health. And finally, Section 5, Medical Treatments and Future Tech, from PDE5 inhibitors to nanotechnology. But what if lifestyle tweaks and supplements just aren't cutting it? Well, the first line of medical defense is the famous PDE5 inhibitor, medications like sildenafil or tadalafil. Remember that nitric oxide pathway we talked about a minute ago? These medications essentially amplify that exact signal, preventing the breakdown of the relaxation chemicals in the smooth muscle. When they're dosed and timed correctly, they allow about 65% of men to resume normal function. But keep in mind, they do come with warnings for common side effects like flushing, back pain, and those annoying headaches. Now, if pills fail, don't worry. There is a very clear, stepwise approach for more severe cases. You are absolutely not out of options. The intervention ladder moves from vacuum erection devices to intraurethral suppositories and then to penile injection therapy, which actually boasts a really impressive 75% success rate. At the absolute top of the ladder is penile implant surgery. And interestingly enough, 3-piece inflatable implants offer the highest patient satisfaction rates of any treatment out there, primarily because they fully restore spontaneity. But honestly, where the science is heading tomorrow is what I have found truly mind-blowing. Scientists are developing eNOS protectants, which essentially shield the enzymes that physically create your body's nitric oxide in the first place. They're also looking at stem cell therapies that don't just treat the symptom, but actually regenerate the degraded smooth muscle tissue itself. And incredibly, they're even developing biodegradable nanotechnology. We're talking targeted nanoparticles that deliver repair factors directly to the aging tissues, repairing the vasculature from the inside out. How cool is that? Which brings us to our final provocative thought. If erectile dysfunction is truly the canary in the coal mine, if treating it requires us to heal the endothelium, reduce oxidative stress, and reverse arterial stiffness, then we aren't just talking about a mechanical fix anymore. If we can successfully treat vascular aging at this micro level, are we actually on the verge of finding a cure for getting older? It completely reframes our entire understanding of human longevity. Thank you so much for joining me on this explainer today. I really hope this empowered you with some incredible actionable knowledge.